Hi friends, welcome back to my channel. I am Rohit, Counselor Professional Recorder and Registered RNC. So in this video I can discuss ICD International Classification of Disease, all chapter guidelines and any query regarding any point comment now. Okay, then start. Medical coding is the translating of narrated medical record into alphanumeric code. Purpose of data to insurance company to establish clinical outcomes. It means for billing purpose. Okay. Then in medical coding there are three types. First ICD, then second CPT, third EPICS. ICD means International Classification of Disease. CPT means Current Procedure Terminology. EPICS means Healthcare Common Procedure Coding System. Then in this video I can discuss ICD all up to end. Then you can do not miss any point. Okay, then start. ICD means International Classification of Disease. In ICD was developed by WHO, World Health Organization. You can read one by one all point. I can skip it some point due to I have not enough time. And anyone need this PDF, then message me. I will share your PDF. Okay, then start. Subjective evidence. Subjective evidence means sign, and objective evidence it means symptom. Then next, I said add two values. First value tabular list, second value index list. Okay, then tabular list is based on body system and structure, and index list is based on four category. A is means first category, index of disease, that includes in alphabetical index all disease. Then B means second table of neoplasm, that includes all cancerous code. And then C table of drug and chemicals. Then D index to external causes. Okay, then I can discuss first how to read code. Then you can first check a report. It means you can open directly sepsis. Check alphabetical index in yes. Yes, in you can check direct alphabetically FEDSIS sepsis. That code is A41.9. As like you can check any code. Okay, it means for example you can check hypertension. You can directly open alphabetical index in H. In you can directly open one by one alphabet index by H, hypertension, HYPERT, SIN. Okay, that code is I10. That wise you can check and discuss chapter wise guidelines and all chapter. Then you can got it all point. Okay, then I can discuss first all chapters. It means chapter name and its code series. Okay, then first disease of infection and parasitic disease, that A00 to B99. Then second neoplasm chapter. Then C00 to D99. Then third blood and forming organ, that is D50 to D89. Then next endocrine disease, that's E00 to 89. Then mental and behavioral, that is F01 to F99. Then next disease of nervous system, G00 to G99. And then next disease of eye and adnexa, H00 to H59. And then next circulatory system, I00 to I99. Then respiratory system, J00 to J99. Then digestive system, K00 to K59. Then skin and subcutaneous tissue, L00 to L99. Then musculoskeletal disorder, M00 to M99. K00 to K95. Then next disease of skin and subcutaneous tissue, L00 to L99. Disease of musculoskeletal system and connective tissue, M00 to M99. Disease of genitourinary system, N00 to N99. Disease of pregnancy and related condition, O00 to O9A. Then certain condition originating in perinatal period, P00 to P96. Congenital by birth disorder, Q00 to Q99. Then sign and symptoms, R00 to R99. Then injury and poisoning, S00 to T88. Then external causes of morbidity, V00 to Y99. Then factor influenza health status, Z00 to Z99. Code for special purpose, U00 to U85. Then VWXYZ external causes, Z status code. Okay, then we will start direct format and structure of ICD. Code always start with an alphabet. Then code contain minimum 3 and maximum 7 character. First 3 means category, 1 to 3 character means category, and 4, 5, 6 it means subcategory. Okay. Then next, ICD-10 is used an intended format for easy reference. You can check first category, then subcategory. Okay, it means category means adenoid. Example, adenoid in subcategory with tonsil, with subcategory acute, with recurrent or specific organism. Then you can check category, subcategory, sub in category. Then you can go to direct code. Then I can discuss how to lead code. Then you can first open alphabetical index in adenoid. Then you can check subcategory with tonsilitis. Then you can check with tonsilitis with acute, then recurrent, then specific organism. Then you can got code J03.80. Okay. Then next point, ICD-10 conventions. Conventions are very important to lead the code due to in ICD coding. Conventions are very important. Okay, convention has 4 types. Then first type, instructional notes that include code first, additional code, code also, code underlying cases, code if applicable. Then punctuations. Punctuations include bracket, parenthesis, colon. Then next, a related term, and with. Then punctuation in bracket. Bracket means to include synonym or alternate word. Then you can check directly to identify manifestation code. Then paracenthesis used in tabular and index to list include supplementary word which does not affect the code number. Then next, NEC and NOS. That is important thing. NEC means not elsewhere classify or other specify. Then you can check direct physician documented as clear the condition. The physician documented as clear for the condition, but the code was not applicable. Physician documented as clear for the condition, but the code was not available for the condition. Is the coding set? That time you can directly go to NEC code. Okay, example, diabetic with hyperlipidemia. You can directly check diabetic in alphabetical index, and then in diabetic you can check hyperlipidemia. There are not documented any condition. Then you can directly go NEC code, specify code. Then NOS, not otherwise specified. Physician documentation was not clear for the condition, but the code available was clear in the coding set. At that time, you can go to direct unspecified code, NOS. Example, bronchitis, J14. Then next, exclude 1 and exclude 2. Exclude 1 include, don't code exclude and exclude 1 together two code or two conditions can't occur together. In exclude one, do not code together. Okay, then exclude two, here code together or both condition can occur together. Code for exclude and exclude two. Then next, placeholder. Placeholder is a X. If digits are not available there, then you can go to direct placeholder. Okay, it's example poisoning and adverse effect code. Then here, if 7 character is available and 6 character is not available, then go to 6 character is means X code. Okay. Then etiology followed by manifestation. Etiology, cause of disease, sequences first. Manifestation, due to disease condition, second condition. Then you can etiology code at first, then second manifestation code. It means diabetic with nephropathy, then you can go to first diabetic, then you can check combination code is presented or not presented. Then not presented, then you can go to direct nephropathy, but here code are presented, diabetic with nephropathy. Okay. Then next symbols, 4-digit code, additional 4 character, 5-digit code, additional 5 character. Then you can go to one by one. Then next, sign and symptoms. Okay, you can read carefully. Then next, multiple code for single condition. If a condition of multiple codes for sequencing followed by instruction notes carefully. Example, alcoholic gastritis due to chronic alcoholism. Then you can directly check in alphabetical index gastritis alcoholic. Then due to chronic alcoholism, that code is F10.20 and K29.20. Okay, then next, acute and chronic condition. Acute condition means sudden onset of a condition. It means curable condition. And chronic is a long-term condition. Okay, then acute and chronic was documented, then sequence first acute followed by chronic. It means example, acute and chronic appendicitis. That code is K35.80 and K36. Then you can directly lead in appendicitis. Burning. If a physician has documented condition as a burning type of discharge. C condition, under burning. Then lap effect. Then next, combination code. A combination code can be possible between two diagnoses. It means a diagnosis is manifestation, then complication. Then you can go to direct combination code. It means nausea in vomiting, anxiety in depression. You can directly alphabetical index open and check nausea code in nausea in C combination with vomiting. That code is R11.2. And you can open second code, anxiety in alphabetical index. Then you can directly complication with depression. That code is F41.8. You can practice it, then you can easy to got the code. Then next, BMI means body mass index. Code BMI, if BMI greater than 40. If physician has documented obesity, morbid obesity, then code BMI separately. Otherwise, do not code separately. Then certain terminology. Then examples. You can lead one by one questions. It means diabetic retinopathy, stone in kidney. Stone in kidney means lithiasis or lithostenosis. Or you can check terminology words. It means kidney, stone, litho. Okay. Then next, you can solve one by one all examples. Scenario means questions. Patient admitted with severe generalized abdominal pain. The physician diffuse diagnostic statement on discharge as a abdominal pain, probably due to acute gastritis. Okay, Then first patient is admitted for generalized abdominal pain, but physician directly diagnosed abdominal pain probably due to acute gastritis. Then you can capture in this condition only diagnosed code. It means you can check gastritis in acute. You can first open in your alphabetical index in gastrics. You can search first G, then AS, GST, then C gastrics in simple with bleeding, acute erosion, with bleeding, alcoholic, with bleeding, allergies. Then you can directly go to acute. Then acute code is K29.00. Okay, that type you can check and you can lead code easily. Then next, patient is seen in the OP clinic with vertigo. The physician diagnostic statement is possible viral syndrome. Okay, then in this scenario you can see patient diagnostic statement is possible viral syndrome. It means possible viral syndrome. Then you can go to direct vertigo code. Due to there are not diagnosed any disease. Okay, then you can directly open alphabetical index in vertigo. You can check first F, and then TIGO vertigo. That code is R53.83. There are no any complication available. Then you can directly go vertigo code. Okay, then you can open tabular. In tabular list you can check direct R53.83. Due to cross check, code is correct or false. Then open, there are specify other vertigo. It means then you can check vertigo NOS, lack of energy, lethargy, tiredness. Okay, it means it is code is true. Then next question. Okay, then we can discuss directly chapter specific guideline. It means you can lead by chapter wise. Then I can discuss directly chapter specific guidelines. It means chapter wise all guidelines. Then first chapter, infection and parasitic disease. In first point, HIV. HIV include HIV related illness, HIV infection. Then there are specify asymptomatic, then you can symptomatic. Then there are specify asymptomatic. Then you can directly go to Z21. That is asymptomatic HIV and AIDS code. And there are specify symptomatic. Then you can go to B20. That is AIDS and HIV related illness and HIV related infection code. Okay, then next you can read one by one sentence. Okay, then next, in conclude serology test. In scenario, physician was perform in conclude serology test. Then you can directly capture R75 code. Okay, and then you can check sympathetic AIDS HIV infection B20 code, asymptomatic HIV non-infection Z21 code, inconclusive serology R75 code, HIV screening Z11.4, HIV counseling Z71.7, test result negative patient return to inform, test result negative patient return to inform, then Z71.7. as like you can capture and you can find code through alphabet index. And then RVF, HIV related conditions, then coded first HIV, then related condition, and then unrelated to HIV, then coded first unrelated condition, then you can go to B20 or Z21 as per sympathetic or asympathetic condition. Then next, any fracture code. It means in scenario there are available fracture plus HIV. Then you can go to first fracture code, then HIV code. You can go to fracture treatment immediate. Okay. Then due to we can capture first fracture code, then HIV sympathetic asymptomatic code. Then next, infectious agent as a cause of disease, B95 to B97. Then you can directly check all code and you can practice it code. Okay, then I can skip it point. You can practice it pneumonia due to E. coli. You can directly check pneumonia in due to E. coli. That code is J15.5. Then you can check UTI. UTI means urinary tract infection due to E. coli. Then you can check its code. Okay. Then any query regarding any point, then comment me. Then I can explain with answer. Then I can explain answer. Then next, MRSA and MSSA, that is IMP. MRSA means methicillin resistant staphylococcus aureus. Then MSS means methicillin susceptible staphylococcus aureus. Okay. Then next condition. Then you can check its code. Okay. Then next, sepsis, severe sepsis, septic shock. It is important point in first chapter, HIV and sepsis. Then sepsis. Sepsis is a then what is sepsis? Sepsis means an illness in which an body has severe response to microbial organism. That is known as sepsis. Okay, sepsis are two types, severe sepsis and septic shock. Then we can discuss first sepsis. In sepsis, septimia code we can capture. It means septimia code is A41.9. That is NOS, unspecified code. Then sepsis with any organ dysfunction. Then we can go to sepsis with severe sepsis code. Severe sepsis code is R65.20. Then you can go to two codes. First sepsis with complication. Then second code, severe sepsis, R65.20. Okay. Then organ dysfunction condition, AOF, acute organ failure, COF, chronic organ failure, or there are specify any circulatory complication organ failure. Then you can go to septic shock code. That code is R65.21. Okay, then I can discuss. You can read one by one point. Then severe sepsis, minimum 2 code required. Code first, followed by severe sepsis, then septic shock. Then septic shock. Then next point. You can read one by one point. In sepsis, there are very severe condition. Then I can discuss one by one. SIRS, Systemic Inflammatory Response Syndrome. That is abbreviation. You can read all abbreviation to easy to solve scenario one by one. Then severe sepsis, advanced stage of sepsis with acute organ failure, septic shock. There are circulatory failure associated. Then you can go to septic shock. Then post-procedure septic complication that result after any procedure, surgery result in sepsis. Okay. Then you can directly alphabetically index open and check sepsis code. That code is A41.9. Or there are specify in scenario any sepsis with complications. Then you can go to sepsis with complication first code. Then second code, severe sepsis or septic shock. There are include any circulatory failure. Then you can go to septic shock code R65.21 and not specify any circulatory failure, only specify organ dysfunction. You can go to second severe sepsis code R65.20. Then you can go to any related condition code, third code. Okay, you can practice it and you can solve septic shock, severe septic call code. You can first lead sepsis. In sepsis you can check severe, then you can lead septic, then you can lead shock. Okay, as like you can lead one by one code, then next I can discuss directly its examples. First, a patient was admitted with AIDS-related Kaposi of the skin. It means KS of the skin. Then you can directly lead first code B20. Then that question directly specify AIDS. Then you can go to direct B20 code. Then related condition, there are specify Kaposi. Then you can check in alphabetical index Kaposi in Kaposi. That code is C46.0. Then next scenario, patient was admitted with severe sepsis due to MRSA. MRSA means methicillin staphylococcus susceptible average. Then with septic shock and acute respiratory failure and hypoxia, there are septic shock is available, then you can do not go severe sepsis. Okay, then first we can capture as per sequence wise. Then first capture severe sepsis with MRSA. It means you can go to sepsis first in alphabetical index. Then you can open MRSA, staphylococcus average. That code is no, there are no available. Okay, then you can open first MRSA in sepsis MRSA. You can go to first you can go first sepsis in alphabetical index. Then you can open MRSA. That code is A41.02 and MSSA code A41.01. Then you can do not capture both code. You can capture only MRSA code. That code is A41.02. Then you can capture septic shock code secondary. I can see first guidelines. Okay, that code is R65.21. Then last capture acute respiratory failure with hypoxia. Then how to capture this code? And then first you can open failure. In failure you can open respiratory. In respiratory you can open acute. In acute you can open hypoxia. Okay, you can listen one more time. You can open alphabetical index in failure. In failure you can open respiratory. In respiratory you can open acute. In acute hypoxia. That code is J96.01. Okay, as like you can solve one by one questions. Then I can skip it. You can solve, and any query regarding any point, comment me. And anyone interested for CPC preparation notes include mock, then WhatsApp now. And anyone need this ICD PDF or anyone need ICD one by one chapter wise all questions with answer, then you can WhatsApp now. I can share you. Okay. Chapter number 2, neoplasm. Neoplasm means cancerous tumor. Okay. Then there are types, neoplasm types. First, malignant. Second, benign. Third, carcinoma in situ. 4, unspecified. Okay. Then malignant means it is spreading cancerous. And benign it is not spreading cancerous. And it is not a cancer. Benign. Okay. Then third, carcinoma in situ. Carcinoma in situ is a cancerous, but it not spreading one side to another side. Any condition or any scenario that mentioned directly spread one side to another side, then you can capture first primary code, then spreading to another side you can capture secondary code, and there are default 12 site presents. I can discuss. Wait. There are 12 default sites. 13 is a classifies. Okay. First brain, second spinal cord, third menine, fourth mediastinum, fifth heart, pleura, next lymph node, bone, peritoneal, retroperitoneum, liver, diaphragm, and third is a classify. There are 12 IMP default sites. You can read one by one. Okay. Then any type mentioned in scenario, then you can direct capture secondary code. That 12 site you can capture direct secondary code, and you can, there are available any primary condition, you can give primary code, or not available any primary condition, then you can direct go to neoplasm table, and neoplasm table in last unknown code or unspecified code available, then you can give first C80.1 unknown code, then secondary code default site. Okay. See, if the patient is documented only one organ site is not a default secondary site, then code primary first. Example, liver primary, liver to pancreas, pancreas secondary. Okay. Then next kidney primary toward esophagus, secondary. You can read one by one. Okay. Then next sequencing of neoplasm, it is based on the documentation. Okay. Then based of treatment based, then go to first secondary site code, and then secondary code primary site code. Okay, you can read it. Then episode of care and complication due to neoplasm. Okay. Then I can tell you how to read neoplasm code. Then you can direct open after alphabetical index. There are you can see neoplasm table. You can open neoplasm table, then see first primary malignant, then secondary malignant, third column carcinoma in situ, then you can watch. Okay. Then that wise you can see series wise there are code available, liver, brain, any site, breast cancer overlapping. You can check one by one proper code. Okay. Then next you can check in scenario any chemotherapy treatment, or any pregnant patient, any fractures patient, then you can go to first fracture code, then neoplasm code. You can read one by one line. Okay. And anyone need this PDF, then contact me. I can share you PDF, and I can share you CPC preparation notes, include mock paper. Okay. Then 4th chapter, endocrine disorder, diabetes mellitus. Diabetes mellitus is increase or decrease blood sugar level in body. That condition lead to diabetes mellitus. Okay. Diabetes mellitus are two types: primary diabetes mellitus and secondary diabetes mellitus. In primary diabetes mellitus, there are two types: type 1 and type 2. Type 1 including E10 and type 2 including E11. And secondary diabetes type including 3 types. First, underlying condition, that is E8. Then drug and chemicals, that is E09. Then complications, that is E13. Okay. And general diabetes by birth, that is including type 1. Okay. Then next, you can solve one by one questions. You can solve one by one question, and any query regarding any question, then comment me. Okay. And question are available in my playlist. You can check my playlist, and you can solve one by one questions. Okay. Then chapter 5th, circulatory system. Circulatory system. In first point, myocardial infarction. In 0 to 28 days, it means 4 week. In 4 week, patient is come, then that is new patient. Or after 4 week patient come, that is old patient. After 24 week, matlab after 28 days, that is old patient. Up to acute MI 0 to 28 days, chronic MI after care, old MI HX healed. Okay. Then STEMI non-STEMI. STEMI means ST elevation, myocardial infarction, ST elevation segment, non-ST and ST. That is a small difference. Then in scenario available non-STEMI at anterior wall. Then you can capture STEMI anterior wall, and there are available STEMI anterior wall. Then you will capture STEMI anterior wall. Then you do not capture EN STEMI code. You capture only STEMI code. Okay. Due to STEMI, non-STEMI convert into STEMI. Then you can capture only STEMI code. Okay. Then CAD and angina, coronary artery disease. That is combination code. You can check. You can directly open in angina. Then you can check CAD. Okay. Then hypertension. Hypertension, it means increase blood pressure in your body. That's condition lead to hypertension. That code is I-10, unspecified hypertension. Then you can direct check hypertension with any condition. It means hypertension with hypertension is DM. Then you can give which code. You can comment now. I can discuss in comment. Okay, that question answer I can discuss in comment. DM with hypertension. Now, okay. Then next, chronic kidney disease CKD. There are available CKD stage 2 and CKD stage 3. Then you can give CKD stage 2. Due to CKD stage 2, 3, 4 are reversible and 5, 6 are irreversible stage. You can capture lower stage up to 4 stage. And CKD 5 and 6 stage there are available. Then you can capture direct given stage, higher level stage. Okay. And there are available stage 1 plus dialysis. Then you can capture direct dialysis. It means ESRD code EN18.6 plus additional Z99.2 dialysis code. Okay. Then next point, poison adverse effect, underdosing. You can read it. It is easy point. Underdosing. Then respiratory system. If the reason for visit for respiratory failure, the sequence first respiratory failure followed by other condition. Okay. You can read it one by one point. Okay, then pressure ulcer. Pressure ulcer, there are also known as decubitus ulcer and bed ulcer. And on there you can see pressure ulcer with type 1 diabetes mellitus, not assigned any code due to ICD-10 guideline. You can capture only non-pressure ulcer with type 1 diabetes mellitus. Okay. Then burn. Corrosion are the burn due to chemical that leads to burn. Sunburn are categorized by L series. Burn are internal and external burn. Deep burn. First degree burn, second degree burn, third degree burn. Okay, then extent agent. You can read one by one point. Okay. Then fracture are three type of fracture: traumatic fracture, pathological fracture, stress fracture. Traumatic fracture due to any accidental condition or any other condition, and pathological fracture are included in any surgery or any other cases. And stress fracture is included in continuously stress on one bone, then breakdown in that bone. That condition lead to stress fracture. Okay. Then pregnancy, there are available pregnancy or delivery, different code. There are antepartum means time period from the day consequent until the date of delivery. That that is antepartum. Postpartum means up to 6 hours from delivery. Then peripartum, month to fifth month from delivery. Okay. Then discuss pregnancy in trimester. First trimester 0 to 14 weeks. Second trimester 14 to 20 week. Then third trimester 28 week to more, up to till delivery. And that separately code, gestation code are available in Z3A category. You can check Z3A category. They are available. Okay. Then you can read one by one sentence. Then you can got it to all points. Okay. Then any query regarding any question, comment me now. Okay. Then abortion types. And any query regarding any ICD or any CPT HIPIX questions, then comment me. And वीडियो अच्छा लगा तो लाइक करो, शेयर करो, सब्सक्राइब करो. थैंक यू ऑल ऑफ यू.